Hey guys, Steve McInerney here.
Rachel.
Rachel here. So Rachel's got a question.
So we had a patient this week who had excruciating pain in her shoulder, which was quite inflamed and we thought was bursitis. And she was finding, obviously sleeping at night was very difficult, so we were trying to think of ways that we could make it more comfortable for her to sleep.
Good. So what we're going to talk about was how to tape someone with an acute bursitis in their shoulder. This technique also works really well with anyone with a supraspinatus tendinopathy or tendinitis or a tear in their supraspinatus. It also works really well with anyone with a deltoid problem as well. So deltoid, biceps or supraspinatus and the bursa. So it won't work very well with people with an AC joint problem. It also won't work very well if they have any other pathologies inside their shoulder, like extensive calcium deposits or things like that. So just watch out for that, make sure diagnosis is good. So we're going to start with 3 bits of tape. I've already pre-cut them, rounded the edges, and we've folded them back here so we know where we're going to tear. Now, what people don't know is that what people often forget about is the 3 properties of taping. So one of the properties is adding proprioceptive function to something, like we taped the knee joint before. So that will help with proprioception, help with control of the patellofemoral joint. We can look at restrictive taping, like when you've got a torn calf and you're doing some restrictive taping on that. That can be really helpful because it's pre-stretching, the tape's pre-stretched, getting to its limit before the calf is becoming stretched and causing the pain there. So that's quite an important property of taping. The other property is support. So this is a good example of how the 3rd property of taping is useful to understand, because when we understand that, then we can apply that logic to dealing with this. So all those conditions I mentioned, they're all going to benefit from having the shoulder supported slightly. So Rachel was saying about using a sling. I prefer the taping because it's direct to the skin, unless their skin gets irritable from doing it. But it's very useful because it does help a lot with offloading the tissue and the pressure around the subacromial area to help reduce the impact. So we're going to start by taping the medial deltoid. So effectively we're going to reinforce the deltoid. So you're going to start on the deltoid insertion tuberosity here, get the patient to relax their arm. You're going to make sure there's no tension on this first 2 or 3 centimetres. We're going to stretch the tape up and then we're going to stick it down on their shoulder. So this would disappear underneath Rachel's top there, and we basically stick that down underneath there. Okay. Now the second piece of tape. The second piece of tape is basically going to reinforce the anterior deltoid. So we pre-stretch the anterior deltoid, so often they're going to have a painful shoulder. Again, deltoid insertion, we're just going to follow the mechanics of the deltoid. We're going to pre-stretch the tape, get the patient to look away with this one, otherwise you stick it to their chin. And we're going to go over the top of the other piece of tape here, and then just stick that down. Now what Rachel should be feeling, if she lets her arm relax there, is she'll feel like her arm's been supported slightly and just lifted up very slightly by the skin and the tension of the tape there, which is actually quite comfortable when you've got someone with a very inflamed subacromial region here. The 3rd bit of tape is going to reinforce the posterior part of the deltoid. So we're going to stick the tape down here, deltoid insertion. Again, no tension on that insertion point. We're going to pop it around here just to take it to the limit of her pain-free movement. Stretch the tape, and then we're going to stick that piece of tape down through here. Now, all these pieces of tape, I would have basically stuck down there onto that one point on top of her shoulder. So she's got a nice supported shoulder there that's been supported by the deltoid muscle being reinforced effectively. So she should feel like that's been supported a little bit, and it can offload it. Now, the other type of person that can benefit from this is if you've got someone with a combined problem. So they may come in with a glenohumeral joint problem or an issue with stability around the joint and they need the support, but also they've got a neck problem as well. So you could use this to tape, offload the shoulder, which is often what's causing some of that neck problem in the upper trapezius to overwork, and then causing the problem up into the neck in here. So when you start to think about these things, you start to understand there's lots of different applications, but learn the basics and apply the basics rather than learning very hard and fast rules. So try and understand what's wrong, try and understand how it's wrong. So this thing needs support, and then try and understand how to apply the techniques to give it support. Okay?
Yeah, very good. That feels really comfortable.
How's
It
that
feels
feel?
like my arms being lifted upwards.
Yeah, yeah, it will do. It feels quite comfortable in
Yeah.
most cases. So anyone with those particular types of shoulder problem, they can really benefit from this type of taping. Good.
Thank you.
Okay, no problems at all. Great. So it's goodbye from me.
And bye from me.